everybody. Welcome to the Coffee Chat. I'm Andy Bozarth, Community Outreach and Advocacy Director for AARP Kansas. And today I'm joined by Bill Blankenship, and we're going to have a conversation about what you as a caregiver can do to ensure that your loved one is getting the appropriate medications if they are in a long-term care facility. Hi, Bill.
Hi.
How are you doing today?
I'm doing fine.
Well, thank you for joining us.
Rain.
Yes, there's been a lot of rain lately.
Yes.
I'm really glad you took time to join us today. And this is a really important subject. And as a disclaimer, neither Bill nor I is an expert in medication management. So this program is all about what you as a caregiver can do to ensure that your loved ones are receiving the medications they need, not receiving more than what they need if they are in a long-term care facility. And so, Bill, do you mind giving us a little bit of history about how this came to be a passion of yours?
Okay. My wife, who was used to work for what was then the Kansas Department on Aging as a long-term care ombudsman, when she retired on medical disability, she was recruited to join AARP Kansas as a volunteer. And she was very active in AARP. Kansas was the first head of its diversity council, was involved in several aspects of AARP as a volunteer. And because of her activity, as her disability increased, their mobility decreased, I became her chauffeur, so I was accompanying her to AARP events. And eventually I became an AARP volunteer. And since, when she had to go into a nursing home, I continued to volunteer for both of us. And since her death in February, that I've continued to kind of keep on going as kind of a homage to her. As I said, she had to go into a nursing home. Through her, I learned the term comorbidities. In other words, she had lots of different things wrong with her at one time. She wound up having 7 back surgeries because of spinal stenosis and arthritis. And after her 7th back surgery, as she was recovering from it, she suffered a stroke. Luckily, it was mild, but it did have some lasting effects. As she was recuperating and recovering from that, she developed a UTI. And so it was finally made the decision that I couldn't provide her the level of care she needed at home, and she needed to go into a skilled care facility. So when she arrived at skilled care facility, which is a great facility, her aunt is still at the same place, and it's a good place and it's well managed. But when she arrived, she was having multiple problems. In addition to these physical problems, including bone-on-bone arthritis in both shoulders and dealing with pain and recovering from the stroke, Marianne had bipolar disorder. And those of you familiar with bipolar disorder is that it can be very effectively managed through medications. But finding that right combination of medications isn't an overnight process. It's a question of guidance from a psychiatrist of trying this, for a couple weeks, then adjusting the medication up or down. And it takes a while to find that perfect balance that keeps that under control. But when she got to the nursing home, they looked at her extensive medication list, and nursing home facilities are very regulated. And, as a general rule, they have certain medications that they have deemed inappropriate for an older population.
Right.
Well, that's fine and good. That's the general rule, but there are always exceptions. There are stuff that may not be good for every other patient, but for your particular loved one, they actually need to be on that. Well, this is something we discovered. It took a while, but Marianne was showing symptoms of the elevated mood, the manic side of bipolar. And come to find out, at some point or another, they had eliminated one of those bipolar medications because it was on that list. What we later discovered was that part of the regulations of nursing homes is that nursing homes will contract with usually a third party that will go in and review the medications for everybody in the facility. And if they detect one of these medications that need to be flagged, they will notify the medical director, the nursing staff, and they will try and cut back or eliminate. Well, in Marianne's case, that turned out to be inappropriate. She continually lacking this medication, she showed symptoms.
Right.
And so eventually, the symptoms on the elevated mood, she became confused in some thoughts and acting out and things like that. Eventually, we had to go have her admitted to a specialized unit. There are certain behavioral units at area hospitals that specialize in older patients.
Right.
And almost immediately upon that admission, the staff psychiatrist said, "Oh, I know what's going on." Looked at her history, happened to know her psychiatrist, used to be a student of his, immediately recognized that, oh, she needs to be back on this medication. Took a couple weeks to get her medications adjusted, discharged back to the nursing home.
Mm-hmm.
And then about not quite a year later, same thing happened. The regulators came in, and meanwhile, there'd been a kind of a turnover in the medical staff that the nursing home had contracted with. All of a sudden, she starts to show these symptoms again, and same thing. Things got out of control, had to be readmitted to a different senior care facility, and that one happened to be their psychiatrist was Marianne's personal psychiatrist. And so he immediately knew what was going on, got things adjusted. But the tale of the story is that sometimes, these medications have to be monitored quite closely, and you can't rely on the facility to do it. They're under pressure from regulators to not have this at all in their facility, but some people actually wind up needing it. So it follows to a caregiver like me to monitor that kind of stuff. It's just, before COVID interrupted things, I was able to see her practically daily. And so I could walk through the front doors and I could smell that if things weren't quite as hygienic as they ought to be. I could evaluate her. I could, talking with her multiple times, I was able to tell things.
Right.
COVID, which is another subject, really interrupted that. And I'm sure that those of you that have loved ones in care facilities, in addition to your loved one being really isolated, lacking visitors, the things slip through the crack. There's turnover in staff and things like that. But medications, and that's something that monitoring the medications actually started at home. As Marianne was developing more and more physical problems, it fell to me to maintain her medications, to pick up prescriptions, to fill out the pill box every week and make sure she's getting stuff on time. And I'd maintain a list, not only for me to fill it out, but I'd have copies of that. I'd have some in the cloud. So when we went to doctor's visits, I was able just to hand over the medication list. Once she got into the nursing home, that became more of a challenge.
Yes.
As I understand the rights of patients, I frequently asked the nursing home to fax or send me a copy of her current medication list. Or whenever I drove her to a doctor's appointment, facilities always print out a reef of papers that show all the medications and the current treatment and test results and like that. And when we got to the doctor's office, I always asked them, could you make me a copy of that so I could look at it closer, and I'd compare that when I got home to what my last record medications were, so I could see what changes were made and when.
Right.
The same thing is when medications were changed. I had a durable power of attorney, which if you've got a loved one in a facility, before they go in there, go through the process, seek legal help if need be, and get that durable power of attorney so
yes.
you can ask for these things. And so the facilities are supposed to notify you if they change medications.
Right. Were you getting notified?
I was getting notified, but sometimes, that, a couple things. Nursing staffs, care staffs are so busy that oftentimes I get a call at 9 o'clock, 10 o'clock at night, and I knew what was going on because the nurse or the CMA had been so busy getting everyone, all the residents into bed, whatever, finally had a little downtime and started making these phone calls of notifying people. So it wasn't always immediately, if you've got a loved one that falls, they're supposed to notify you, changes in medications, changes in behavior. I would get that, but sometimes it's not as timely as you would like.
Right.
And these other medication changes that were coming through the regulators, that process, when Marianne had to go in a second time, the nursing director at the special care facility, senior care facility, said their number one cause of readmissions was because of the regulations. They had altered medications.
Wow.
And so it's something that you absolutely need to stay on top of, is so you can, like I said, the nursing home was great. If I wanted a current medication list, they would email or fax it to me. That let me compare it to the last one that I had seen and see if there are changes. But, nursing homes, staffs change, medical staff changes. They've got a lot of residents in there, and, it's something that falls on the loved one, just like making sure the things are safe, making sure that, the food is still quality. Medications are something that you just have to stay on top of and have to really monitor.
Oh, yes. Yeah.
And especially, there's a good reason, as I found out, for why the feds, why the Medicaid and Medicare, CMS, why they were wanting this stuff, is because they were trying to fight the battle of more unscrupulous or less caring facilities over medicating people who weren't necessarily having a psychiatric problem, or, their form of dementia manifested itself in some, poor behavior, some disruptive behavior. They were trying to make sure that patients weren't being over medicated. And that's a good cause, except for the people who had been diagnosed and are being treated with a medication that they needed to have a good quality of life.
Right. And I know that AARP fights to make sure that people are not over medicated in nursing facilities, because a lot of times that is what you hear about facilities. We don't hear this other side of people who have mental health issues going into facilities and having that medication cut. And for those of you who are just joining us, welcome to the Coffee Chat. I'm Andy Bozarth, Community Outreach and Advocacy Director for AARP, and I'm joined by Bill Blankenship, and we are discussing what you as a caregiver can do to ensure that your loved one receives all the correct medications to maintain their quality of life if they are in a nursing facility. And full disclosure here, Bill and I have been friends for a long time, and his wife and I were very, very good friends. And I'm so sorry for your loss, Bill. That it was really hard for all of us, and I know it was more difficult for you. And in the process, you took such good care of her. As a caregiver, fighting for her medications to be correct, what was your path of getting in contact with people, and who did you have to work with to make sure that she did get what she needed?
Typically, the person I wound up dealing most with is initially the nursing director at the facility.
Mm-hmm.
At most nursing homes, they contract with a physician or a physician group. And at this particular facility, they had a nurse practitioner that would be there and make rounds daily.
Good.
And that person, when before this period of interruption by COVID, I was able to stop by on my visits to Marianne and chat with that person and raise concerns and do that. Eventually, when it became a problem of, involving these regulations, at that point, the social worker who is in charge of that wing of the facility or your loved one, then that's also a good person. And eventually, if you have to, go to the director.
Right.
I was lucky because Marianne worked as a regional long-term care ombudsman for the aging department in Kansas. And so she knew her rights. This is something that she used to investigate and used to try and resolve at nursing homes. So when when the bipolar wasn't flaring up, she was her own best advocate about things.
You bet. Yeah.
When things were a little out of whack with the medications, she was unable to do that. But I'd learned enough from her as to who to call and whose chain to yank in order to get some things done. And that's absolutely what you have to do. You have sympathy for the staff because they are, the populations typically at or close to maximum. There's waiting lists for facilities. People call in sick. Things get a little stretched. And you often can detect when something is going wrong long before the staff, although there have been staff that had been at the facility since she was admitted and knew her quite well. After living, decades with her, better than anyone else if something's off, if something's wrong. And that's your job, is to go in there and say, I know it may not show up in the test, but there's something off,
right.
Something's going wrong, and we need to find out what's happening on that.
Oh yes, and the primary caregiver is the person who does know the loved one who's in the facility the best. And if for more information, you can go to www.aarp.org/caregiver, and we have a lot of information on what you can do to help your loved ones when they are in a facility. And again, if you have any questions, please put those into the chat box. We have got a little bit of love from the chat box, Bill. People saying, thanks for enlightening us on this important issue. And then a couple more people who've said they are watching from Topeka and from Missouri. And so I think we are getting close to the end of our time. And so is there anything that as a caregiver you'd like to suggest people do? We could go on about this forever. But what is your best advice to somebody who's a caregiver for someone in a facility?
That for us, looking back on experience, the best thing that we did, and not everyone may be able to afford and have to look for some alternatives, but getting that durable power of attorney, getting all of those things done.
Yes.
When the person initially goes in, so those documents are on file with the nursing home facility, that they can fax them to the emergency room if they need them there, is to really prepare. And, when we were looking for a place for Marianne to go into, we used AARP. There's great stuff on the site about how to select a nursing home, what to look out for in nursing homes, and tell those kinds of telltale signs. So it's a great resource. It's something that all during the time that she was there, that I would look up things on the site, and it would steer me to places where I could find answers.
Thank you, Bill. Again, I really appreciate you taking time today to join us. And thank you to those in the audience. And we will see you again next week, same time, same place.